Welcome, everyone, to another episode of the Loans Can Be Fun podcast.
Yep.
We're joined again by Dr. John Clayton. And before we get started, I just want to let you guys all know that on our website, loanscanbefun.com, you can find all of our podcast episodes, as well as contact information for everyone on our podcast and some
we have a
others.
big resource page on the website, so you can find people there. So if you ever need anything,
we're not just
we're not
helpful
just
in loans. We're helpful in life.
we're helpful in life.
Life
guys.
can be fun, not just loans can be fun.
Exactly.
Awesome.
That was good.
Okay.
Loans are fun for you guys, not for me. So
Yeah, I tell people
Well,
loans
they can
can be fun. Like, what is it? Loans can be fun. Doesn't mean yours
It
is going
doesn't
to
mean
be.
yours is going to be, but we'll try our best.
Yeah.
We'll give you cavities with
Yeah,
all
we
the
give candy. We try to like lessen the blow of having to get a mortgage
That's how
loan.
loans are fun.
Yeah.
Exactly.
Well,
Lessen the blow.
I would take a mortgage loan over a student loan any day. So.
Yes, it's true.
Yeah, yeah.
Yeah. Except there's so much more on the mortgage loans.
It's
usually,
true, but
unless you go
people
to like law
don't.
school.
People don't say they're gonna forgive your mortgage and then no. So
Well, they haven't forgiven student loans truly. So
that would be pretty annoying.
Yeah.
Kind of back.
Okay,
and
well, I
forth,
think they should go back and forgive my student loan that I already paid off by working.
that's and that's the question I think people get is like, if I worked hard and paid it off, what's the point? You know?
Well, so I had a roommate in college that she got her degree in modern dance, and she had student loans. Like, are you going to pay that off? I mean, she was a
How?
great dancer, beautiful, but that's not a career.
Exactly.
And so, for most people, I should say.
like, because it's not like cheerleading.
No, and she didn't.
Like, not that there's anything
she
wrong
did-
with that, but
she
like-
just went into like a government job and whatever. But it's
Yeah.
like
No,
she
but,
had
like, you
student
still have to
loans,
pay
but
it
it's
back.
like you
What would
still
you
have to pay that
use?
back.
What
Yeah.
would
You
you
wouldn't.
use that degree for?
You
Like,
wouldn't.
what
That's
type
my
of
point.
dance?
Modern, but you wouldn't. That's my point. It's a useless
like a
degree.
backup- like a
I'm
background
sorry if that's
dancer?
your major and things like
Yeah,
that. But
I know people in those situations though. Sometimes if they know that they can't go in or like they can't pay it off or they won't be able to pay it off, they'll
Yeah.
look for some kind of like service type
Yeah.
orientation, and then they'll use that, and they actually will forgive that loan by doing service for so many years through a
Interesting.
certain company or environment.
I guess it's my sister-in-law, so she does like music therapy. And so her degree, she's very qualified, like lots of
Music
degrees, but like,
therapy.
yeah, she does music therapy and things like that.
You're feeling anxious. Listen to this heavy metal.
Crazy thing is that is
There's-
actually what makes me feel better.
My best friend growing up, that's his calming music. Is
It's the
metal.
weirdest thing
Yeah.
because, like, if I had a really hard day, I go and blast My Chemical Romance, Helena, and I
Really?
just rock out.
That's not heavy metal.
way.
No, but it's like he's yelling and it's like fast and it's like intense.
Yeah,
We're
it's
not really
either you yell or they yell, right?
Yeah.
So
exactly.
Or you can yell together
yeah, there you go.
to a melody. There we go. Music therapy.
Should we talk about
so,
John?
back to
No, don't talk about you guys. Talk about
This
you
is
guys.
why we call it Loans Can Be Fun. It should be like loans are a mess. No.
loans can be.
So we've brought John in again because we wanted to talk to him a little bit more. There was just not enough time in that last podcast to cover everything. So
And it looks really good on camera.
and he looks really good in
so-
all his yellow, and his car's out in our parking lot and it's yellow.
We'll show that at the end, I guess, right?
It's awesome. Yeah, I was actually like, we need to take a video of that and put that on the end.
Yeah.
He drives the Supra, you guys, the Supra Chiropractic. Why do most people come to you? Pain, right?
Yeah, mostly pain. That's what typically it's people that can't handle the pain. Like, no offense, but they can't
Right, it's
handle
just gotten
the
bad
pain,
enough.
and they've thought it would go away. Typically, most pain does go away.
Right.
So they just need some intervention to help with that pain.
What do you say to people who are 45 and they get hurt doing nothing and the pain lasts for 6 months?
I
my
say, you dealt with it for that long. Why did you not come in sooner? But it's typical though, because people live busy lives.
Yeah.
And they've got everything else going for them that they need to do in their schedule and daily life and work.
I'll literally
So-
have like tendonitis for like 6 months for no good reason.
Yeah, yeah.
it's, like,
That's so common though.
Yeah.
And that's where you have to really look into their life and just say, hey,
What's causing that?
Yeah, what's causing this? But then also like, let's get you better as fast as possible because you need to go back to your life. You shouldn't
Yeah.
then revert your life to chiropractic because your tendonitis is going to now take over your life, and that's most
Right.
important versus your family and your work, right?
Would you say most people come in for neck pain or back pain or both? Like, what's the biggest?
Typically, yeah. Like I talked to the coach that I work with, and he just said, if you could name your practice on the pain you treat, you should name it Neck and Back Pain Clinic.
Yeah.
Literally, because that's what most people Google
Yep.
is. I have neck pain. Who do I go to? I have low back pain. Who do I go to?
Makes sense.
So one thing that I have experienced myself, but also heard, is I feel like in the world of chiropractors and normal people viewing chiropractors,
Normal
right?
people.
They either
not normal.
absolutely love and swear by them, or they think that's just a fraud. Like
Yeah.
they're just not wanting
Just
your money.
quacks.
So
Yep.
What do you say?
what do you
people?
say to that? Like how do you prove that you're not just a fraud? I guess. Like I don't think you are.
Yeah,
But
yeah.
like
No, exactly.
how do you?
I
how do you do
think
that?
I think some of the things to address. I think we talked about it a little bit last time, but the answering the questions right off the bat of like, you know, how much. Well, can you help me with whatever problem they're facing? How much money is it going to cost? And then how much time is it going to take
Yeah.
to fix that? By addressing those like right up front, and typically that's why I tell people I'm like, if you come in one visit, like when you came
Yeah.
in, it's like you come in one time and then don't come back unless you need it, right?
Right.
And so I think ultimately you don't want to waste people's time. And I think that's where a lot of chiropractors go wrong is people come in, they're like, great. Like I had a patient come in, they're like, I heard that if I come here, you're going to put me on a care plan and I'm going to have to keep coming back, 2 times a week, 3 times a week for X amount of time to see resolution. I'm like, oh, that's a joke.
See, but I think that is
So,
what in my
that's
experience
like
is
99%
that's what
of
most
chiropractors.
chiropractic offices do. So my
Yep.
dad was an orthopedic surgeon growing up.
Yeah.
And growing up, that was his complaint about most chiropractors is they're not actually fixing it.
Mm-hmm.
They're just basically getting somebody to keep paying money every single week and feel good for
Exactly.
a day or two.
Yeah.
Yeah.
So do they do like the wrong thing?
And that's
Like
where
on
that's where
purpose?
you
Or
that's,
like-
that's the
hope not.
question because you
I would
don't
hope
really
not
know.
either.
And so I think the generalization that I've kind of come to is that when you adjust somebody, nobody has different bones than anybody else technically,
Generally.
right? You all have the same bone structure, bone types, same amount of bones typically in your body. And so if you just say, hey, I'm going to kind of do the same routine over the body every time, that's what I think where you can go wrong is that if you walk into a chiropractor, and typically people pay attention to this, if they've gone so many times and they just feel like I got the same adjustment every single time and I didn't get better, it obviously didn't work. And it's like, well, that's why you do different things or check different
Yeah.
areas, right?
Well, and I know
Okay,
when
so
you and I've
kinda
talked
get-
before, you've kind of talked about, well, what's causing it? And maybe you have to strengthen a certain part of the body.
Yeah.
Maybe it's pulling too hard one way or the other. Like
Or breathing differently.
breathing
Talked about
differently. He
last
told me to
time.
breathe through my fat belly rather than my lungs.
I didn't say fat. Breathe through your
I
belly.
said
Breathe through your
fat.
belly.
Yeah, but like different things that cause pain in the body, or a lot of times, would you say things are because of imbalance in muscles?
Yeah, to a degree.
Because
Yeah.
I know that for me, I sit at a desk every day like this,
Yeah.
and so it's like I need to bring my shoulders back. And
Yeah.
anyway.
Well, I think so. Yeah, there's I'd say let's just break it down into maybe 3 categories. So you've got the nervous system or your nerves, right?
Yeah.
And then you've got the musculoskeletal, or so the muscles and the skeleton together.
Yeah.
And then you've got, or you could even let's just break those down even into 2 different ones: muscles and then skeleton. It's like I can work on the skeleton, right? Like when I adjust, I'm adjusting the bones that connect, or the joints that connect the bones together.
Yeah.
And then there's muscles that hook onto those joints or around those joints. And there's also nerves that run around through the muscles, into the muscles, out of the muscles. And so if you're just addressing one piece of the pie, you're not really going to get all the resolution unless you bring in all the different pieces together. And if you don't address
Right,
all the
it needs
pieces,
to be.
you got to refer
I don't know
out.
if the word's holistic or like it needs to be all encompassing.
Yeah, the whole picture.
Yeah,
Yeah.
And so
Instead of just being stuck into a routine.
Well, I
that
mean,
you
a lot
do
of these
with
places
everyone.
you go in and they just pop you, from what I understand, and
Yeah.
you're in and out. Thanks for
there's
cracking my neck for me.
Not a lot of education in there, and that's where I think more chiropractors need to do better in is that addressing an issue, but also addressing parts that they don't necessarily fix or they won't fix, right?
Yeah, I think being
So-
upfront is probably one of the best things you can do. Is, hey, this is probably never going away completely.
Yeah.
But can we make it manageable? Sure.
Yeah.
Or whatever. I hate this is probably gonna take you 6 months of coming in twice a week, and you're still gonna
you're still gonna have
hate
the
your
problem.
life or whatever.
Yeah, and I think too, the more that people like me, we kind of address that and we kind of call it out almost of
Yeah.
you don't need you shouldn't have to go into that kind of treatment protocol, and you should be able to give chiropractic a trial period
Yeah.
or just try it even one time and just see. And I think doctors need to, or the chiropractors need to understand that you've got one shot to work on this patient, make it worth it for them.
Right.
And help change their mind and educate them So they want to come back, not because they're forced to or they're scared about what condition you presented them with, that they feel like now they have to come back because you scared them to death. They have, you know, their curve in their back is too big or too small, and you're going to change that curvature. Just educate them on how to help themselves and not scare them or use scare tactics, so that it promotes them to live a better life, or it it encourages them, or it empowers them.
Yeah,
right.
That's a good word.
About their body.
Yeah.
Right?
So this is kind of, I don't know how to phrase this exactly. So there's a lot of chiropractors that kind of get into some alternative medicine type things. Does your office have any of that kind of stuff? Like there's one office that deals with like removing allergies, and other things like that, which I think works for some people, but it's also kind of it's not Western medicine.
Yeah.
You can see, feel, touch, whatever.
Yeah, and I think that's where a lot of chiropractors need to be more vocal, or maybe it's on their website, maybe it's, you know, somewhere out there, where you educate people based on what you do. And if it falls under a specialty, that's kind of the terminology I'd like to use nowadays, and that's how I phrase my stuff that I do. Is I've got alternative things in my office that I consider specialties that they don't necessarily apply to everybody,
right?
But those who need it will
be able to find it,
right?
Yeah.
So yes, allergies was one of those things, and I think it does fall under the specialties, as long as that person is specialized or they have a certification in that. The one under chiropractic that I believe, there may be more, but it's NAET.
Yep,
I've
done it before.
Yeah, so there's that one. I think that's probably your best protocol for allergies. So if you,
it's such a, like, to me, I call it voodoo magic.
It's cool
because it doesn't, like, you would be like, that should never work.
Yeah.
But I've seen it work.
Yep.
I've also seen it not work, but, you know, or like it wears off or whatever.
Yeah.
But it definitely, I've seen enough people that have eliminated allergies.
Yeah.
That you just go, what?
And that's the thing too, is when it comes to certain things like that, like I'm not certified in the NAET stuff, and I'm not certified in like hardcore neurology either. So whenever someone comes in, they say, I have allergies, and it's like, hey, I can do this, this, and this. I can do dry needling. I can do your sinus area. You know, potentially I may even do that balloon technique where you go up and open up the sinuses from inside your head and stuff. But then again, it's like, I'm not the NAET guy.
Right.
I will refer out for that.
Right.
I have no problem with that.
Right. Well, and I've never heard of other chiropractors doing the dry needling. Like, I mean, but I'm not like I haven't done that much. Like, you're the first
you have
chiropractor
your business
I ever,
you focus on.
ever visit, you know.
Yeah. So, but yeah, like I just referred a patient that came in. They came in with the spasm part of it was their eyelid. There's a spasm in the eyelid.
Oh man!
And it
wouldn't go away.
Yeah, and it's been going on for 2 years now, to the point where if they're driving their vehicle for work, their eyelids want to shut. And so I'm like, there's certain things where I can draw the connections to, you know, cranial nerves, to different brain neurology.
Yeah.
But I'm not a specialist there. And so I adjusted the patient, I educated him, but then I contacted a clinic in Ogden.
Yeah.
And I said, hey,
do you guys do that?
This is something that I feel would be more in your wheelhouse. Can I give you the information and then send this patient to you as a referral? Because at the end of the day, it's like, can you help that person or can you take their money? I'd rather help them rather than just sit there and take their money.
Well, I think if you focus on doing the right thing for people, it takes care of itself. And that's kind of what we've always done at Loans Can Be Fun, where it's like, there's time where we've had to eat it on certain loans. It wasn't our fault necessarily. But it also wasn't the client's. Well, there's times. But you know what I'm saying? But it wasn't, the client shouldn't be the one that suffers.
Yeah.
And so we always try to do right by them. And it's the same thing with you, where it's like, if you're not going to be able to help them, then let's get them where they can get help.
And we have like we'll tell you if we can meet or beat this price, and we'll be the first ones to tell you.
Like, run, that's a good
one. Go.
Yeah.
Like, you can't,
lock that in today. If they'll tell you, they'll do that. Go lock seriously. It right now.
Like, I think that's good, just business practice in general, because I think that's where, I mean, in our realm, we call them raving fans, but like, that's where lifelong customers come from.
Yep.
Yeah.
Is when they know that their interest, maybe
well,
not.
If they know they don't have to go to him
but
40 times to address an issue because he told them that up front, you know, that for me, if people will just be upfront on things, I am golden.
Yeah.
But it's you need 6 more months of this or whatever.
Yeah.
Like, nope.
Well, I think
or if you do, tell me why.
Yeah.
Explain it.
Yeah. When I think too, it's like in any industry, even like in loans, if you brought someone in, you said, hey, I'll give you a 5% loan right now.
I wish they could do that.
Yeah, it's like
Yeah.
you couldn't do that, and then someone like it's a form of lying, right?
It's like
Yeah,
bait
with
and
bait and
switch.
switch,
Yeah,
and
that's
that's
ridiculous.
and so
we don't ever do that.
That's I think where I've seen also in some cases within chiropractic is that they'll throw out a generalization statement that's almost a promise. And so to me, when anyone says like there was one that came up that this person is like, I have low back pain, it was a disc injury, and so I reviewed it with them yesterday, but I was like, I don't want to do anything until we look at your MRIs and I educate you based on what your MRIs say. When we sat down and talked about stuff, we looked at the MRIs, but from that Facebook post, when I went back through the comments, it was a little bit disturbing or annoying, I guess, for a chiropractor was basically like, it was like no commitment, forever relief, and then like little out of pocket expense or something like that. Like, and it's just like,
Yikes.
you don't know that. You can't, why would you tell someone or incentivize that for someone to come in? But if they
Somebody
came
you
in
haven't even evaluated.
exactly. And
Or
so
even
it was really,
talk to
it was
That's
really
hogwash.
frustrating.
I would call that person out online.
Yeah. And so it was really frustrating because it's like, why would you say that? Or why would you do that? And I've gotten to the point too, where if someone comes in with a diagnosis or something, I almost want to say, call that doctor and say, are you willing to put your license on the line for that? Because I'm going to call BS on that, right?
Yep.
Because ultimately your job, no one's perfect and we're doing a practice, but make sure you're doing everything you can to help people. And I don't know, in the end,
Do
it's like,
chiropractors have to do that Hippocratic Oath thing too when you go to school? Okay.
Yeah, well, do you know
what
harm?
that is?
Yes.
yep,
Okay.
yeah.
Grey's
Yeah.
Anatomy.
So, and that's, but
Do
I
no
think
harm.
too, it's like we are probably one of, I'd say, as far as like harming patients, as far as injuries go, we are one of the least
Yeah.
out there. But I think the damage is done in our reputation and how
Yeah.
we communicate. That's where the harm I think is done nowadays. And I think if we were to say, let's expand the Hippocratic Oath, does that involve that, or are we just only referring to malpractice as far as injuring people that way?
Right.
You know, but yeah, that's a conversation
Yeah.
for another time,
So-
I'm sure.
With let's just say, on average, most people that come into you, how many sessions do you think you do with them in order to get them? And I know this is a blanket statement, but like, how many sessions is typical for somebody that comes to your office?
Most patients, I will see them 1, maybe 2 times. And
'cause they don't like
it'll
you,
be
so-
that
Just kidding.
probably,
No.
honestly,
No.
who knows?
No.
Well, and that was scary at first, but I would see
It's because
patients.
you did a good job.
And yeah, we'd spend a good amount of time working on them. Like it's a minimum of 30 minutes. I'm working on a new patient.
Yeah.
But even if I have time, like if I look at my schedule and it's like, hey, you got another 15 minutes, I will take that 15 minutes with that patient rather than just sit there and like be on my phone.
Right.
I'd rather take that time to educate that patient if I have it to
Right.
be with them. And so, like I said, most people, it's literally one visit.
Well, and you have a lot of
maybe
good
2
reviews
visits.
too.
Yeah, yeah, and that's part of it too. Is people will read those and they'll go, "Holy crap! This guy saw me one time, and I was out of pain. I was educated on how to keep myself out of pain, and I do those therapies at home, and I'm good." Right,
Yeah.
and that's where people really get drawn in. And so, I would say honestly, most people I see on average of my new patients 1, maybe 2 times.
And then if they have
And
another
then if they
injury
come,
or something.
yeah, they come back in. But there was a guy that came in, and it's like, holy crap! Like, when was the last time I saw you? And he goes, last year. I'm like, that was your first visit, right? And he goes, yeah. And I was like, and he's like, I've been good until then. And my wife just finally convinced me, like, hey, let's go in together because
Yeah.
I need an adjustment. You might as well just do a yearly
Yeah.
tune-up as well, right?
Yeah.
So yeah, I'd see some patients once a year.
So you really have to find lots of new patients all the time just because you don't drag it out like
Yeah.
everybody else does.
Yeah.
I shouldn't say everybody. But
Yeah, well, a lot of them, yeah. So, and that's the cool part is it's like I'd rather bring in new cases and new problems, so I'm always learning and I'm always staying fresh on it versus like the typical I threw my back out kind of thing,
Yeah.
kind of issue. So, and it is nice too because I feel like when you see the same people over and over again, to a point for me, it's very redundant.
Yeah.
Like a car accident case where you see someone, you have to see someone on to a reasonable degree because the car insurance, if they don't see that someone's injured and they're not coming in frequently, they don't justify paying for the
paying for
care.
it.
And so that's the only time where I've had to tell people like,
You need to
because
come
the
in.
insurance dictates like if you truly have an injury, you would be in a clinic often, whether it's at a physical
Mm-hmm.
therapist, a chiropractor, whatever it is. And so that's the only time where I tell people, not because I have to, but because the insurance, says that this is how it works, and for them
This
to pay
is how
for you,
injured you are.
yeah, then that has to be proven, right?
Right.
And so to me, and it makes me look better too if it's like someone's coming in for an injury, if they got better after one visit, yeah, that's cool for me.
But their lawsuit doesn't.
But yeah,
look
their
very
insurance
good.
is, their insurance is going to say,
Yeah.
you truly weren't injured then, so we're not going to pay for this. So there is that weird line too, and that's why there is a lot more
There is
education
some,
with
yeah.
car accident cases, and I definitely think that there's more room to grow in that area for me as far as educating patients. Like it took me about 2 hours I took my lunch yesterday to see a car accident patient who was in a minor collision, had seen another chiropractor. The chiropractor downplayed because it was someone backed into them when they were parked.
Yeah.
The chiropractor downplayed it because he's like, that's
hurt.
not an injury. You were just backed into from a car. And I was like,
Boom.
but if you actually did the research, people in lower, like 15 miles an hour and lower crashes have ligament damage versus like muscle, bone, that kind of damage. And so ligament damage takes longer to heal from
Absolutely.
than it does with.
So I'd rather
the other
break a
ones.
leg than like roll my ankle.
Exactly.
They heal better.
So in the end, more people.
Trevor's like, I wouldn't.
Yeah, seriously, you'd be in a cast or
No, but
whatever.
like sprains, like ligaments being injured,
I'm learning.
they take a long time to heal.
Yeah.
Whereas the bone, it's like, okay, I mean, they still take a while, but like I have an ankle injury from high school that still bugs me.
Yeah.
Because I tore the ligaments to no end. But it's that kind of thing. But yeah, people that get in car accidents, some of them can be so bad, the injuries. But I remember in elementary school, they actually had this thing where they had us sit in these seats and a 5-mile-an-hour stop. Just
No
how
way.
that felt. It was, I mean, impressive how much even 5 miles an hour kind of like,
Yeah, it hits you good.
stopping like dead like that was, and if you have them coming together at the same time at different speeds, it like compounds it. It's exponential.
Yeah, it really is. It really is.
It's a big math problem where it's not just 5 and 5. It's like
Yeah, I don't do the math portion of it. So, yeah.
it's something.
Just tell me the number, and that's what goes.
And you'll
That's
fix
what
it,
goes. Written,
no, because I've
down.
actually seen those where it's like when two things hit at the going a certain speed, it's not it's the combined speed essentially. And yeah, you can get pretty jacked up in car accidents.
Oh yeah.
Because my husband got rear-ended. He's a full stop, whatever, and got rear-ended, and he had back issues for a long time that we didn't really realize. Hey, like this was from the accident, but it was. I mean, we recognized that's probably from that, but he probably should have been getting some help and didn't. But
yeah, and usually you don't think about it in the moment because I think most people in that situation, just like anything else that happens to you in the world nowadays, your first reaction, especially in Utah, is to say, "I'm fine." Right.
Right.
Mental health, anything like that. If you ever any issue at all in the world right now,
we're fine. Everything's fine.
I'm fine.
Everything's
and it's not.
fine.
Everything's fine.
Yeah, it's not true. And so most people will downplay what happens in.
Well, they don't want to be an
car
ambulance
accidents.
chaser.
Yeah.
But guess what? There really are times, like I ended up having to take him to the hospital that night because he couldn't remember my phone number.
No way.
So he had like gotten rocked.
Yeah, he's got he probably has like
he didn't think he thought he was
TBI
fine
or something like
yeah,
that.
he thought he was fine, and he just had a little concussion.
Yeah.
But it's like he didn't even know he'd hit his head.
Wow.
Type of deal, and I was like, okay, we're going, we're heading in there. But yeah, so people don't always realize how bad it can be with a car accident. And
Yeah.
So that doctor dismissed the patient and was like, "That you're not that hurt."
Who was a chiropractor? He's
Yeah.
like, I don't think you could have been injured. And I was like, but I asked her,
Who
I
are
said,
you to say?
when you were hit in that accident, like what position? Like that's the big question.
Yeah.
Is what body position were you in? And she's like, oh, me and my boyfriend were turned and talking to each other like this.
Oh, ouch.
And I was like, you literally take impact from the side at that point.
That's bad.
With rotation through your whole entire spine, and then your head is turned, and so your whole entire skull is going to go like that and shift over. Like you're way messed up now.
Yeah.
And so, in the end, it's like you got to look at the whole picture of it. But there are some situations where people do milk some symptoms and stuff, and so you do have to be aware of that too. And,
Right.
So they actually do teach you tests like that in chiropractic school.
How to
or
like
doctor
test
school.
for if they're actually hurt.
They're called malingering tests. So
Really?
if you you can check for people because if they're like, oh, everything hurts, and then you can do different tests to find out if they're lying or not. But you'd hope that people aren't doing that.
Right, but there are people who would.
Yeah, for sure.
I know one.
Yeah. Trevor.
No, it's not Trevor. No, it's not Trevor.
I'm the epitome of the I'm fine. And
I
limp away.
hit Trevor
Yeah,
with
seriously.
like a corner of a bucket that was sharp, and I split his eyebrow open at a restaurant. He leaned over right as I was
I was
lifting
like
this
fixing
thing up.
my chair and she was moving it.
No.
Dunk. And then, I mean, it wasn't a huge.
No,
thing,
but I was like, oh, I'm fine. And then they're like, you're bleeding. Like, oh.
Is it getting hot in here or something? Like, it's like sweaty.
We're
in
like,
here.
okay. So then, I think I had to do like a workers' comp thing, or I told him that you needed to, or something, or was
No,
that the dog bite?
that was the dog bite.
He got bit by somebody's dog
No
when we
way.
went to
It
visit
was a
him.
little puppy and they were like hurting me. Like, 'cause
Hurting.
I
Like-
was leaving and they're like on my
Nipped him
ankle.
on the
and
back
I'm
of his
like,
ankle?
Get out of here.
Whoa.
But I had to call and they had to do like this whole workers' comp thing. Did you go to the doctor? Did you bleed? I'm like, no.
But I was like, I probably need to do that because I don't
It was
want to
a
like.
puppy. Like,
Yeah.
it was like an Australian Shepherd puppy.
He was trying to
Okay.
tell
Like,
him,
they're like-
this is where you
Like,
go.
keep going out.
No way. That's when you just react like a horse and just kick back. Boom. See ya.
Yeah.
I mean, yes, the dog should have had more manners. Like,
Right.
yes, I get it. But like, it wasn't like a. Get
Did you go to the chiropractor after that? After you threw your back out when it bit your leg? And you're like, "Ugh."
I didn't. I've never been to the chiropractor. We've
Oh
talked
yeah,
about
Trevor's
this.
like scared. And
Yeah.
I've
Well, I don't
been
even
scared
like
too.
popping my knuckles. Like I hate popping anything.
Yeah.
So
my
like,
kids are like, like Rice
everything.
Krispies. Like I'm
so does-
like
so
stop.
does my wife.
My oldest is like always like just turning his head where I'm like, that thing's gonna fall off one of these times if you keep twisting it like that.
I really need to get my wife in to see you because even 2 days ago she's like, I messed up my neck.
Why
I'm like,
hasn't
go get
she
it
gone? We
fixed.
talked about
Yeah.
it.
I know. I don't.
That's when you just set up the appointment and
Yeah,
just be like,
I
"Hey,
got you an
set
appointment with John. He's waiting for you.
Should.
Do dry needling for me. Tell her with love from Alice.
She would. She would.
Yeah.
It didn't hurt. Like to me, that was
do
not
it.
that bad.
Yeah,
it was
it's not-
uncomfortable,
it's not
but it
bad.
wasn't bad.
That woman's
Yeah.
pain tolerance is insane.
Is it
Like I'm like, ow, and she's like, what?
really?
Yeah, she's insane.
I don't know if I'm tough or not. I think in some ways I am. In other ways, I'm a total like.
I am.
I think we all are like that.
I'm 100% a wimp.
Like I hated having babies, but I was induced,
Yeah.
and so
And you had the
I had a
epidural.
biopsy.
yeah.
Yeah.
I had a biopsy right here and almost passed out
While they were doing it,
while they were trying to stitch me up.
might-
Even though I couldn't feel anything, I totally logically I'm like, this is totally fine. I'm like,
my husband passes out when he gives blood.
what
Really?
the heck?
Like his body just goes, I just lost too much. It's time to die.
No
Oh,
way.
I'm a wimp.
And he's not like he doesn't. I mean, he's given plasma. He has this freaking scar on his arm from giving plasma
Yeah.
so much. But like they take his blood and his body just like constricts and like knocks him out. I'm
No
like,
way.
Nice. And like my oldest son, when he had blood drawn, he went to get up really fast, and then he was like, "Oh, I feel very good." I'm like, "Sit down," and he like goes white, and he's like, "I'm gonna throw up," and we're doing the whole shock treatment. And Griffin, my youngest, handled it like a champ, so we're good there.
We are derailing like crazy today.
I know, but I figure we have a lot of stuff, so we just have to bring it back to.
Yeah, yeah. Well, I do think donating blood though, like every time I've done it, it's like I do
feel it.
I feel it afterwards, and I feel like I get sick afterwards because it's like I just lost blood and my immune system's a little bit more compromised, so I always feel like I get like a little cold after or something. So,
Interesting.
yeah.
I mean, and that's the thing. It's like for his body, it thinks it's losing too much blood, and he passes out. It's not because he's scared of the needle. His body just goes. He almost passed out when I was having a baby, and they did the epidural.
those are intense.
That was the worst thing to watch.
Well, and I think that's what happened. Is I don't see the needle. I don't know what's going on. But I'm having a contraction as they're putting the needle in, and so I'm like closing my eyes and I open my eyes, and his pupils are like this big, and I was like, "Are you okay?" And he's like, like he couldn't even
Catch
talk.
him,
He was-
catch him.
I was like, "He's gonna pass out! Grab him!" So they get him over to the couch, and
Man,
but he was like,
For our second kid, when they did the epidural, they hit a nerve.
"Oh, I had that. It
And
hurt."
I have I've never seen my wife in that much pain.
Yeah,
And it was like sudden and jerky, and I'm just like,
yeah.
no way.
I had it
Oh
where
my
they
God.
basically they hit something, right? And makes you kind of go like that. They're like, hold still. I'm like, you freaking just like stabbed something in my spine
That
into a
needle's
nerve
huge, too.
ending, like whatever.
Oh my gosh.
Okay, so let's bring it back to.
let's bring
Oh no, you're good.
Okay, so John, what is the best way for people to get in touch with you and like set up an appointment or whatever?
Yeah. So from my website, there is a link. Like, as soon as you click on my website, it has a prompt that just says schedule your first appointment, or if you're a new patient, or just if you click off of that one, there's another one right below that just says click to schedule. you just go on that,
What's your website?
suprachiropractic.com.
Okay.
Super easy.
You can also find it at loanscanbefun.com.
Yes, it will be on our website in the
You
resources.
link to the book now, I think, thing on there too. So, or at least
Yep.
the link to the website. So,
Yep.
so you just go on there and then just select which one applies to you. If you're a first patient, pick the red one. It's a new patient visit. If you just need an adjustment after you've already been a patient there, you just click on the yellow one. Just remember yellow. It's the most common one that people pick. And then if you need specialty stuff, it's either blue or purple. So, but if nothing makes sense and you don't understand, you just call, I explain it to you, or you can, message me on social media.
And John does a lot on YouTube as well. So you can actually see the procedures he does on people. So if you're nervous
And
or
it's linked on his
Yeah.
website.
Yeah.
And
on the
it does show
LoanScanBeFun
more of the
website.
intense side of what I do, because it shows how I'm different from other chiropractors. But then I can always tell you, like, hey, I'm not going to do that on you the first time. We're just
Right.
more there to address different issues. But
Right.
And he's
but-
totally fishing for views, because more intense.
yeah, I wear those low cut shirts, so which
as you should.
yeah, I know.
Exactly.
I need to find
He's an influencer.
yeah, bald people are not really high on the list of people that they're sought after. So
Whatever.
in videos.
I think Ed Harris, man.
Yeah, Bruce Willis.
Of course, younger Ed Harris. Now he just looks like
Dwayne
the
The
guy
Rock
from
Johnson.
True.
He just looks
true.
like the guy from Poltergeist now. The scary old man.
Cool. There's a lot of bald people,
Yeah.
I think he'll
Vin
have a weird
Diesel, have you
shaped
seen
head.
it with hair? He's like weird looking with hair.
Yeah, it was like curly too.
It's like creepy.
Really?
Yeah.
Isn't that not his real name?
I'm sure it's
don't
not.
think it
Who would
is,
name
yeah.
him Vin Diesel?
Yeah.
You'd be surprised.
I think he
Okay,
changed.
well,
I think he
what's
changed
the
it.
origin of Diesel? Is that from Poland? Like, it's not.
Yeah,
like,
I don't know.
It's a cool theater stage name. Whatever
Doesn't
they
Nick Cannon, one of his 12 kids, have a really weird name?
Probably.
Like December or something?
a really weird name.
Or like Elon Musk's kid.
Why is April an okay name but December's not?
too
Ask
long.
yourself that question. And Summer Wheatley. I just thought of that.
My niece's name's Summer.
Yeah.
Yeah.
So we're super grateful for you to come back. And, if you ever want to come back again, we're always open to learning more.
Absolutely.
But again, everyone, please check him out. Go get adjusted if you need to.
Yeah, I mean, I went and did it just because I'd never done it, and he was part of our networking group. So I was like, well, this will be our one-on-one.
There we go.
And he popped everything. I have no idea. I had no idea like certain things were joints. But and I had him do dry needling in my shoulder where I always have trouble, and that was kind of an interesting thing. It didn't hurt. Obviously it was a needle,
Yep.
but it really wasn't. It was just kind of a weird sensation. But it seems to bring blood to that area and things like that. So anyway, get in touch with him. Again, you can find him on his website, Supra Chiropractic.
Yep.
And he also has YouTube. And then you can also find him on the Loans Can Be Fun resource page. But
And
thanks
it has
for coming
links to all of his social media as well.
Yeah, okay.
Thanks for having me.
So really go to Loans Can Be Fun to find John.
The easiest way, right? there.
Use the middleman.
It's probably the first link on this anyway. So
And we don't get anything for that, just FYI, guys. So
Exactly.
we just like
But
to have good people for
Use
you to
use
talk
the
to.
middleman.
Use the middleman.
Don't
The
skip
Loans
the
Can Be
middleman
Fun.
this time.
exactly.
Thanks for coming, John.
Yeah. Thank you.